Initially, I had gotten a diagnosis of endometriosis through another doctor with a laparoscopy. And I actually was not happy with how he was treating me. And so I had decided to find a new doctor, and I actually found this office in a magazine at St. Louis's Best Doctors. And so I made an appointment here, and I've been very pleased with Dr. Gray-Swain since I've been here. And she immediately started helping me with, I have infertility alongside the endometriosis, and so she was helping me try to combat the cramping due to endometriosis and also our infertility problems. I was around 15, 16 whenever I first started noticing symptoms, and it wasn't really until my mid-20s that I finally sought treatment for it. I've always had very heavy cramping all my life. And it had gotten to the point where there were days that I literally could not get out of bed. I was in so much pain, and I would have severe bleeding for days. I would have, the pain would be so bad I would vomit. And so talking to family members and other girlfriends of mine, I quickly realized that this is not normal. And so I sought out another doctor, and I had suspicions at that point that I may have endometriosis. And he was, he thought that I may have endometriosis, and so they did a series of tests, including a laparoscopy, and it came back that I absolutely had endometriosis. By that point in time, I was in so much pain. We had had so many struggles with trying to get pregnant that I was ready to get the test and find out absolutely what was going on. So I think for a lot of women, they have to get to that point where they, it's too much and they have to know what's going on. After I got the diagnosis, I started talking to friends, family, coworkers, and found that many of them knew people, or they themselves were suffering with endometriosis. So it was nice to talk to them and find out what they or their friends were doing to help combat it. Right now, she has me on birth control. She has me on the Loestrin FE24. And that has substantially helped. I only have a period now once every, or 4 times a month, or I'm sorry, 4 times a year, which is great. I don't have to worry about every month making all my plans had to revolve around my period, because I would be stuck in bed for days, and I kind of feel like I finally have my life back, that I don't have to plan around my period. If I do have my period, the cramping is not so bad. I can just take an ibuprofen and go about my day, and I'm fine. So I'm really happy with finally not having cramps all the time.